Hi everyone, I'm Macy
I'm
Isabel?
Jenny.
and Rory. And Rory the baby. So today we're going to be talking about a study that we were researching, and this study was originally meant to look at relapse in schizophrenia and how symptoms change when people reduce or stop their meds. But what really stood out to us was that even though the goal was research, the participant safety wasn't the priority. um, as we saw when people started relapsing. Um,
Perfect. And I can start with the first section,
okay.
which is about the aim of the study and then what they gained from the study. And like we kind of mentioned in our intro, the study was aimed to discover the predictors of relapse and the natural course of schizophrenia, and by doing so, watching how symptoms in patients will change, whether their medications are reduced or completely discontinued. However, the study quickly became ethnically controversial due to the harm it was causing the participants. Researchers withholding these medications from the patients, they were relapsing with only the intent of being watched and measured. But there was no regard, no safeguards, no plans for anything that would happen as a result. Like when they did start withdrawing, when their symptoms were bad. It brought a lot of issues to families of the participants who became publicly frustrated. One family stated that even after resuming treatment after the study, their son never returned to normal. And then another case, their son talked about like SI during his relapse and then ultimately committed suicide. And these stories from families and participants highlight that this study purposefully exposed these individuals to psychological harm without protecting their safety or well-being. And then after this all was reported to the U.S. Department of Health and Human Services, and then they looked into it, they found that all the consent documentation was missing a lot of key elements that they were giving these participants. Specifically, it was not covering all of the risks that could come with withdrawal and relapse. So this forced the researchers to revise their consent forms, which hindered them from getting more participants until the new consent forms were approved. And then they had to reconsent all of their current participants with everything fully disclosed. Um, and then that response also, like having them looked into, showed that there was no consideration for risk or protection. And then from an ethical standpoint, the study clearly demonstrated a violation of research ethics by initially exposing vulnerable participants to big risks without giving them fully informed consent or having safeguards. And then individuals who have schizophrenia experienced impaired decision making while they're having these episodes of withdrawal or relapse, which makes having a good consent process and harm prevention hard to do. And then just having families in the dark and the intervening of the federal investigators just shows that they crossed a lot of ethical boundaries.
So as you stated, Jenny, the research was conducted during the study by violating the rights of vulnerable persons without getting informed consent, as the individuals were unaware of the risks they were taking by participating in the study. I believe you resourced Rovner, 1992, for that. And in 1974, the Belmont Report was created in order to protect these rights of individuals from inhumane practice. Specifically, this became about after the Nuremberg trials, and I got the information from the Office for Human Research Protection. The Belmont Report lays out several ethical principles that must be followed during research to protect human rights, which I'll discuss more about later, but even though the research conducted was unethical, the scientists were able to gain some information that is important to the treatment of schizophrenia. They learned that withdrawing from antipsychotic medications, there would be quick relapse to schizophrenic episodes, and they were pretty intense from some of the stories I read, and I got that from Ventura and other authors of 1989.
Perfect. And then I kind of covered a little bit on the next area, which was concerning the 5 human rights. And in this study, we discovered that self-determination, protection from discomfort and harm, and fair treatment were all violated. Self-determination was at risk due to the participants' histories of schizophrenia, making them fluctuate decisionally in their decisional capacities, and then putting them through the medication withdrawal further hinders their capability to make clear and conformed decisions. Ethic work flags dose reduction and or discontinuation as an area of requiring careful support for autonomy and informed decision making. And then protection from discomfort and harm was clearly violated by putting them through withdrawal, heightening the risk of relapse in many participants, resulting in their severe psychological suffering, impaired functioning, and safety risks. There is thorough evidence that states that the risk of relapse is not hypothetical, but it is well documented. It is a well-documented outcome when antipsychotic medications are reduced or discontinued in patients who are prescribed them. And then fair treatment is hindered when vulnerable populations were put in a place that of heightened risk, not for their own benefit, but for the benefit of the study to generate new knowledge without any safeguards.
And then something I wanted to add to what you said about self-determination and protection from harm. Another important right that was indirectly affected is privacy and dignity, especially in how the families were excluded from information despite those clear signs of deterioration. When participants were experiencing relapse or SI, families were not adequately informed or involved, and that limited their ability to support or protect their loved ones. And this lack of transparency undermined both dignity and fair treatment. It also reinforces that these violations didn't occur in isolation. And once autonomy was compromised, it led to a cascade of other ethical failures that placed the participants at continued risk rather than helping keep them safe.
Yeah, and then in the next section, we're kind of continue off those. I feel like those tie closely with the ethical principles. So there were several that were violated during the study, which the Belmont report specifically outlines several ethical principles that need to be followed when individuals are entering any research study. So the first ethical principle that was outlined in the Belmont report is respect for persons, otherwise known as their autonomy. Each individual has the right to make their own decisions, which should not be obstructed unless it clearly causes harm to others or themselves. In summary, every individual that enters the research study should be voluntary and with adequate information to make an informed decision and provide consent, which I got that from OHRP, which is Office of Human something. Human Research Protections.
Oh, yeah.
Yeah. And in this study, the patient's autonomy was denied because individuals were making consent. They were like signing consent forms, but they didn't have adequate information to make that decision. So the informed consents that were signed were excluding the foreseeable risks of alternative treatment and alternative treatments, which made them invalid, which was from Ryan, 1995. Further, the Belmont report states that individuals with diminished mental capacity to make their own decisions should not be protected, according to the OHRP. And in the UCLA research study, there were a few safeguards to protect individuals that were incapable of making informed decisions to participate in this study. During the study, individuals were stabilized on antipsychotic medication, then taken off of it. And in order to receive medication again, the participants had to agree. However, one participant stated that after stopping the medication, they were no longer in the right frame of mind to be able to make that decision. So when they asked, they told the researchers no, and then they were not put back on medication. That was according to Ryan, 1995. The individual's example of being in the wrong frame of mind and not receiving needed medication shows why safeguards should be put in place to protect individuals that can make their own decisions, which was definitely violated during the study. And then the next ethical principle explained in the Belmont report to protect individuals' rights in research is beneficence and non-maleficence. So beneficence is the right for one to make their own decisions with maximized benefit and reduce harm to each person. And in the UCLA research study on schizophrenia in the 1980s, the research participants were not receiving maximum benefit and harm did occur. The researchers told the participants they could be placed back on antipsychotics, had their symptoms of schizophrenia returned. However, they were not given the medication when they asked for it. So several individuals that entered psychosis and suicidal ideation from the loss of that antipsychotic, and that resulted in direct harm to the patients. According to Ryan, 1995, I'm pretty sure someone actually did end up committing suicide, and they were just withdrew from the study. So, so beneficence and non-maleficence were both violated in that study. I mean, harm was occurring, and we weren't thinking about the patient's best interest. And then the last ethical principle is justice, which was described in the Belmont report, and that is the distribution of benefits and the burden of the research study. Well, in the research study, so the researchers and the participants should have an equal amount of burden versus benefit. And that wasn't the case. And during this study, individuals were not given the equal benefit, and they actually carried more of the burden as they were going through the withdrawals. And they were denied access to that adequate care, like they didn't receive the antipsychotic after they were taken off it, and the symptoms progressed to such high rates. So overall, the study violated every ethical principle that should be followed by researchers to protect individual rights. Do you guys want to add anything to that section?
You covered it.
Oh, thanks.
Okay. And the next one I discussed was the Nursing Code of Ethics and the provisions that were highlighted during the study. So there were several. I chose, I think, two that stood out to me and like definitely stood out. So provision 2 states a nurse's primary commitment is to the recipients of nursing care, whether an individual, family, group, community, or population. And that's from the American Nurses Association, or ANA. In this case, the nurse's obligation was to provide care for the patients rather than the desired wishes of the researchers. An example of this would have been one of the participants said they were suicidal and did not receive adequate medical care. That's from Ryan, 1995. In this case, the nurse would refer the patient to mental health services rather than allowing the researchers to discharge the patient from the study without adequate care, which is what occurred in the study. And I'm pretty sure that resulted in harm to the patient afterward because they didn't get that care. And then the provision 6 states that nurses, through individual and collective effort, establish, maintain, and improve the ethical environment of the work setting that affects nursing care and the well-being of nurses, which is also from the ANA. This would mean that the nurse is responsible for upholding an ethical framework while caring for the participants of the study. The nurses should have advocated for the injustice to the participants if they notice the ethical principles. Like, I don't think I read anything about what the nurses, or if there were even nurses in this study, but if there were, they should have advocated for the patient's rights in that case, instead of letting what happened happen.
Yeah, I agree with what you said about provision 2, and that should be the nurse's primary commitment, like being to the patient. And I also think this situation highlights how difficult it can be for nurses working in research when the study protocol conflicts with patient safety and like knowing when to speak up. So building on that, provision 6 really stands out to me because it emphasizes the nurse's responsibility to maintain an ethical environment. In this study, nurses were in a position to recognize worsening symptoms and suicidal ideation. And ethically, that should have triggered advocacy and escalation when that did happen, even if that meant challenging the research team. So it really just shows how nurses play a critical role in protecting vulnerable participants when research crosses ethical lines. And I guess I have the next section, so I'll jump into that. So the UCLA schizophrenia medication study could have been made more ethical by strengthening informed consent, increasing safeguards, and prioritizing participant safety over data collection. And then, according to Rovner, 1992, federal officials required UCLA to revise consent forms because they failed to clearly disclose the risks of medication withdrawal, relapse, and suicide. So a more ethical study would have required transparent, ongoing, informed consent that included families when appropriate and reassess the patient's decision making throughout the whole study. Additionally, participants should have been immediately restarted on antipsychotic meds at the first sign of relapse rather than keep watching as it got worse and worse and worse. Independent oversight and clear criteria for stopping participation when harm occurred would have reduced the risk. Larkin, 2019, emphasizes that clinical research nurses experience ethical conflict when protocols prevent them from advocating for patient safety, like I kind of said it already, but so just empowering nurses to intervene and escalate these concerns could have prevented serious harm and still being able to research too.
Yeah, Macy, I agree with your thoughts on how to improve the research study. Throughout the study, it was very apparent that the major issue was that participants provided consent without appropriate information regarding the study and the harm that could occur from it, which is from Ryan, 1995. The study would have been more ethical if information regarding risks of the participants were disclosed and the participants were granted protection if they were deemed not in the appropriate mindset to make informed decisions throughout the study, which is from the OHRP. And like I said earlier, some of them entered such bad psychosis they couldn't consent, so they should have had some protection for that if they were trying to watch symptoms and had let the patients know that that could occur.
Yeah. This last section, I have again. So even though unethical studies may produce knowledge, that knowledge does not outweigh the duty to treat research participants ethically. The harm that happened in the UCLA study, including relapse, long-term deterioration, and suicide, demonstrates that the real human cost of unethical research practices. And that's from Rovner, 1992. Allowing harm to be justified by scientific benefit risks, repeating historical abuses, and undermines public trust in research. And Larkin also explains that when nurses are unable to advocate for participants due to restrictive protocols, moral distress and ethical breakdown does occur. Ethical frameworks such as the Belmont Report emphasize that respect for people, beneficence, and justice must remain central to research, even if that changes some of the potential scientific outcomes. Patient safety needs to be number one. While data from unethical studies may still inform future practice, it should serve as a warning rather than a justification for violating the participants' rights.
I agree with that. I also think that it depends on the study because I think we discussed in our prepare module for this that some studies you can't get participants consent, and that would be an example of when it's okay, such as when it's such a large study and it's like a disaster, like a natural disaster, like you're not going to find every participant. And that was one of the examples of when it would be beneficial.
Yeah, and it's not like an
It's not
antipsychotic medication, like something.
not something that we're trying to cause harm. So the benefit still is to the people that were in the study. I think that's what is the
Yeah.
most important.
Yep, I agree. All right.
I
Anyone
think
else
that's
have
all.
anything? Yeah, I think that's all we have. Thank you for listening to our discussion.